Now it's time for the English session. Let's begin today's session. Good afternoon, good evening, and good morning to one and all. Let's begin this session with a 1-minute silent prayer. I welcome all respected doctors and our dear well-wishers for 962nd day of Zoom meeting on International Session of IFPH. It's my indeed pleasure to introduce the guest for today. Our guest is Dr.Dharshana Balamurugan. She is the faculty at Government Homeopathic Medical College and Hospital, Tamil Nadu. She was former SRF in CCRH Siliguru. She has completed her MD and done her dissertation on the topic efficacy of individualized homeopathic treatment in cases of psoriasis vulgaris, a double-blind placebo-controlled clinical trial. The individual publications of Dr. are Individualized Homeopathic Medicine in Treatment of Tinea corporis, which is published in Journal Homeopathy by TM Medical Publications. And the second one, Individualized Homeopathic Medicines in Treatment of Vitiligo, which is published in Journal of Alternative and Complementary Medicine. The third one is Individualized Homeopathic Medicine for Lower Back Pain in Lumbar Spondylosis. And the fourth is Individualized Homeopathic Medicines in Pediatric Epilepsy, which both are published in Homeopathic TM Medical Publications. Today, she is here to discuss on the topic case presented with hypopigmentation. With all due respect, I welcome Doctor for today's session. Welcome, ma'am.
Thank you so much, ma'am. Good evening to one and all. Am I audible, ma'am?
Yes, audible.
Ma'am, I'm not able to share the screen. Darshana B, can you please make me a host? Darshana,
yes.
Not Darshana Balamurugan, Darshana B.
Darshana B, okay. Okay, doctor, yes. Wait. Please make Darshana B as the host. Can you make Darshana B as the host?
Can you see the slide?
Yes, it's visible, ma'am.
Yeah, thank you. Actually, there is a problem with my video, so
okay,
I have joined again. Actually, I have. So actually, there is a problem with my PC, so I'm not able to correct that. So shall I on my video after completing my presentation?
Now it's visible. Video is also visible. Now
because I'm just actually I'm connected with my mobile. That's why it's visible.
Okay.
I cannot access both mobile and laptop as well as together. That's
okay, you can do with your convenience, ma'am.
Okay, thank you. So, good evening, one and all. I am Dr. Dharshana. Now, today's topic of discussion is a case presented with hypopigmentation. Now, why this presentation? To demonstrate cures with homeopathy? No. To show the presenter's efficiency? No. To discuss about the remedy which have been prescribed? No. But to share an experience with the case. Also, just to brush up some known facts which related to the case which is going to be presented. Patient details. Mrs. KB. Basically, she is from Murshidabad, West Bengal. Presenting complaint. 31-year-old female, Mrs. KB, came from Murshidabad. She is belonging to low socioeconomic status and she presented with the complaints of hypopigmented spots, especially in forehead, hands, as well as in abdomen. She came at 2019. So that was her first visit. History of presenting complaint. Hypopigmented spots in forehead, hands, and abdomen since 3 years, which is gradual in onset. Lesions actually scattered all over the body after pregnancy once. There was no itching, no discharges, there is no history of scaling, and there was no hypothesia. And next, she had cracks in tips of fingers, which occurs on and off. Occasionally, she used to get sometimes in winter. And for that crack, she had allopathic treatment and recovered. Pain around the nail bed, especially she had tearing type of pain and tingling sensation, which got aggravated after cold exposure, and sometimes she gets aggravated by winter also. And she felt betterment by putting them in warm water. And she had difficulty in walking along with the pain over the joint, which is dull aching pain. There is no specific modalities that have been expressed for this joint pain, and tightness around the mouth, hands, and abdomen. Because of the feeling of tightness, the patient had difficulty in opening her mouth also. Past history, there was no histories related to hypertension, diabetes, cardiovascular disease, or any other chronic diseases. But she had cracks, and for that she had allopathic treatment and recovered. Along with that, there was a recurrent episodes of abscess in hands and palms for last 10 years. Coming to family history, there was a history of vitiligo in her younger sister. Also, there was a cancer history in paternal grandfather. Also, cancer history in paternal aunt. Actually, patient was not able to explain about the type of cancer which they had. So she just simply said there was a cancer in grandfather and aunt. And coming to physical general, appetite reduced, and she had sneaky satiety. Associated with, she had the sensation of something in throat. Also, there was a burning pain or burning sensation or burning irritation, especially after eating. Also, sore taste in mouth. Thirst was adequate, and tongue indented, stool. She had altered bowel movements, especially constipation altered with diarrhea. Urine normal, there was no pain, no burning, or no difficulties with urinary symptoms. Coming to sweat, she had profuse sweat all over the face, which is especially after overexertion, which is slightly offensive. And sleep, sound, she prefers to lying on side. And coming to menstrual history, that is regular cycle. Menses last for 4 days, and it's a 30-day cycle. And it's a past history. Before 4 years, she had continuous spotting. For that, she took a homeopathic treatment and recovered. Now, concomitant with menstruation, she has low back pain just before the menses, and occasionally she develops breast tenderness before menses. And leukorrhea before menses, which is thick, and after menses it got disappeared. And she is very sensitive to cold exposure as well as winter. So she has cold intolerance. And coming to mental genitals, she desires company. Anger is very much intensified in this case. Even she beats her child whenever she gets angry. And she has fear of thunderstorms. And her complaints get aggravated by consolation. Coming to life space analysis, actually she separated herself from her parents during her childhood, because there is some other voice also in, I guess.
Yes, doctor, it is muted, doctor. Don't worry.
Okay, thank you so much. Actually, she got separated herself from her parents during her childhood, because her younger sister has gone. So she does not want to disturb her parents. So she separated herself from her parents and she started staying in her relative house. But that didn't affect her much. She was brought up in her relative house and she married on her own desire, staying alone with her husband. There was no specific mental trauma had been encountered than this. Physical examination, she's conscious, alert, oriented, afebrile. Actually, she was paler, not ectic, not cyanose, clubbing, grade 1, no pedal edema, no generalized lymphadenopathy. And systemic examination, cardiovascular system, respiratory system, nervous system, and abdomen, everything was normal. On nail examination, clubbing had been encountered, which is grade 1, as we have already said. And oral mucosa, there was no abnormalities. In external genitalia, actually, it was not examined, external genitalia. And this is the photograph of the patient. Actually, patients' eyes had been masked as it is unethical to show their identity. That's why it had been masked. I guess you can see the forehead lesion. Actually, these forehead lesions are taken after treatment. I'm not able to gather the previous images which I have taken before treatment, but the lesions of hand, these lesions of hand had been taken before treatment. But the lesions of hand had been took by the patient herself only. So hand lesions are taken by them. So this is what the patient image. Now, before going to the prescription and follow-up, let's discuss about the diagnosis and differential diagnosis. Then we can go for follow-ups and prescription and everything. So kindly please share the probable diagnosis and the investigations which can be done in this. Please share in chat box. Any guesses? What could be the diagnosis?
Vitiligo, ma'am.
Vitiligo. Then, is there any other suggestion? Leukoderma. Fine. Vitiligo, leukoderma, or anything else? Freckles, pityriasis alba. Fine. Okay. Thank you. So thank you so much for responding. Actually, as you all, as per your guesses, it was referred to me as a case of vitiligo. But while going through the case and by seeing her in person, I felt it is not vitiligo but something else. Then what it could be? So let's discuss about some differential diagnosis. Here we are going to discuss about some diseases which can be presented with hypopigmentation. First one, nevus acromigus. Actually, as it is a nevus, it presents since birth. It is not a acquired condition, it's a congenital form. So these patients usually present since birth, lesions present since birth, and as you see in this image, this is locally distributed or segmentally distributed. Margins are not well defined. As you can see, margins are feathery. So this is nevus acromigus. There will be no itching, no pain, or no hyposthesia. And second one, this is spibaldism. This is an autosomal dominant condition. Here also lesion present since birth, but here lesions are associated with leukotrachea. What is leukotrachea? White is discoloration of hairs. So associated with leukotrachea and white forelock. White forelock means discoloration in forehead hairs, as you can see in this picture. So this type of patient usually present with whitish forelock. In this case, especially extremities are spared. I guess you can see in this picture only hypopigmentation and normal skin. There is no hyperpigmentation. Sometimes they may present with hyperpigmentation also, but by looking at their forelock itself, we can diagnose them. Bipaldism. Also, this is a congenital condition. These are all the clue points to diagnose this bipaldism. This is white forelock. I guess one political party also had this disorder. At the end of the session, we will discuss about that. Next, this is vitiligo. Actually, vitiligo can be acquired. Sometimes it can be congenital, but usually it occurs at usually it is delayed onset. Usually adults are suffers from vitiligo, but still children also get affected, but usually commonly males and females are equally affected, and there are many types, but all types are present with trichrome pattern. What is trichrome pattern? As you see in this picture, there will be three colors in the lesion: hypopigmentation, normal colors, as well as hyperpigmentation. So there will be a trichrome pattern. By this we can diagnose vitiligo. So here also lesions are associated with leukotrichia, whitish discoloration of hairs, and vitiligo patients usually respond well with the treatment. Fine. And this is our patient image. This is the case what we are discussing now. This is connective tissue disorder. Here you can see salt and pepper style of distribution. You can compare vitiligo and connective tissue disorder. Here, in case of vitiligo, there will be trichrome pattern, but in case of connective tissue disorder, there will be a normal skin and hypopigmentation. There is no trichrome pattern of distribution. So with this, we can come to the guess about connective tissue disorder. Also, along with this discoloration, they will be presenting with overlapping of many features. For example, they may present with heartburn, arthritis, cold intolerance, abortion, or some other symptoms also, which can be related with hypercoagulability. Especially these patients present with heartburn and hypercoagulability. So here it is salt and pepper discoloration, but in case of vitiligo, patients usually present with trichrome pattern. And while differentiating your diagnosis, as you people told that freckles, actually in case of freckles there will be hyperpigmentation, no hypopigmentation. Also leukoderma is a general term which is used to indicate hypopigmentation. That is not a diagnosis, that is a generalized term which is used to tell about hypopigmentation. Now, let's discuss some positive pointers which made us to think about connective tissue disorders. She had history of cold intolerance, which can be related with Raynaud's phenomenon. She had whitish discoloration, especially salt and pepper style. She has tightness of skin that produces bird beak appearance. That is a specific finding of connective tissue disorder. And she has arthritis, also heartburn, sensation of something in throat. So these are all the points which had been made us to think about connective tissue disorder. So as we thought this is a case of connective tissue disorder, the patient has been advised to do ANA, which is sensitive for connective tissue disorder. And this is the report. Actually, ANA is anti-nuclear antibody, which was positive in our case. So for further diagnosing the type of connective tissue disorder, ANA profile had been advised. Here in this case, SSA antibody, anti-centromere antibody, and Jo-1 antibody. These are all the antibodies negative. So systemic sclerosis, inflammatory myopathies are excluded. So for further diagnosis, U1-RNP antibody, which means anti-ribonucleoprotein antibodies, which is positive in our case, which is specific for the diagnosis of mixed connective tissue disorder. So this is a case of mixed connective tissue disorder. Also, she has positive Smith antibody, anti-Smith antibody, which is especially present in SLE. As it is a case of mixed connective tissue disorder, there is a positive in Smith antibody as well as ribonucleoprotein antibody. So this is a case of connective tissue disorder. This is a repertorization chart. Without complicating the symptoms, this case had been repertorized by using synthesis repertory. In this chart, sepia has come first. Arsenicum, calcarea, and calicarb occupied second position. Though calicarb was at second position in repertorization, the patient had been prescribed with calicarb because considering the causation of ailments, especially after pregnancy and parturition. So Calicarb has been prescribed in nillismal potency. Also, she had advised to continue physiotherapy. And she continued sorry for the interruption. Actually, she continued with 0 by 1 to 0 by 27. In between, there was some remissions and recurrences were encountered, and repetitions were modified according to the symptomatology. Also, for some acute illnesses, she had been prescribed with some other medicines as SOS. So 0 by 1 to 0 by 20, till 0 by 27 she took. Till March 2022, treatment continued with calicarbonicum. At March 2022, she had an acute febrile attack and she took allopathic treatment and recovered. But after that acute attack, her totality got altered. So according to that altered totality, she was prescribed with natrum muriaticum. So till today, she is on follow-up. She is on natrum muriaticum only and doing good with natrum muriaticum till now. As I have already mentioned, this is the photograph after treatment. Pigmentation got improved. Comparatively, her tightness also got reduced up to 70%. And abdominal and cracks also disappeared. Her heartburn is improving now. Also, gradually she gained weight. Her improvements have been monitored with the help of SF36 questionnaire, but I didn't mention that. Now, I'm sharing some other connective tissue disorders which had been presented with similar hypopigmentation. This is a case of systemic sclerosis. She was also the case of connective tissue disorder, but this is systemic sclerosis. She was also presented with hypopigmentation. I guess in this case, you can get exact bird beak face. The tightness of skin, nose you can see. And this is another case, which is systemic lupus erythematosus. So, connective tissue disorders can be presented with a simple hypopigmentation that should not be neglected. It should be carefully evaluated. And continuous monitoring is needed to avoid unwanted complications. So, this is what I wanted to share. Now, is the diagnosis affects prescription? No, though the prescription will not change either in vitiligo or with connective tissue disorder, prognosis varies. While comparing vitiligo and connective tissue disorder, vitiligo is not a life-threatening disease that will not lead to mortality unless and until with the association of some other diseases. But connective tissue disorders are different. They are very dangerous. As per the available sources, survival rate is minimum 5 years in connective tissue disorder. Maximum it can be extended up to 10 years, but minimum 5 years. So this is the circumstance where the diagnosis becomes crucial to avoid unnecessary complication which is fatal. So here prognosis of connective tissue disease depends upon the organ which is affected. If the patient is present with anti-cardiolipin antibody IgG, that case should be carefully monitored because that indicates severity of connective tissue disorder. Because if the antibody is present, that produces thrombotic stage. So the patient may develop severe stroke or MI in future. So that should be evaluated. So by diagnosing, we can get a chance to teach the patient about the red flag symptoms, which has to be hospitalized immediately so that we can increase the lifespan or we can increase the survival rate of the connective tissue disorder. The similar thing had been emphasized by our Honeyman in Aphorism C of Organon of Medicine. Actually, this screenshot had been taken from Kunsley's edition of Organon. So, according to our master, the knowledge of disease is as important as the knowledge of remedy, dose, and potency. So, conclusion. Actually, in modern medicine, choice of therapy is based on the type of the disease and severity of the disease manifestation. Especially if the disease becomes life-threatening, they used to give systemic glucocorticoids or cytotoxic agent. If the disease becomes very severe or if it affects multi-organ failure, then only they used to. But until then, the ultimate goal is to control the acute phase, to suppress the symptoms. That is what they are also doing. So to suppress the symptoms to an acceptable level. So without any doubt that symptomatic treatment is possible with our homeopathy also. So conclusion is either vitiligo or connective tissue disorder, homeopathic treatment will be based on symptom similarity only. Even though we are treating with symptom similarity, to achieve our holistic approach, we have to master the diagnosis on which we are selecting simillimum. So I just wanted to wind up my presentation with a disclaimer. This presentation is not to promote any fascinating diagnosis, but in order to prevent the misinterpretation about the sufferer's health. So hereby I should thank you so much to one and all who are all present here. And thank you so much for your patient hearing. And I shall thank to the people who organizes this session to learn together. And thank you so much.
Thank you, doctor, for such a wonderful presentation. The case presented was well clear and well explained. She has explained about the diagnosis and she mentioned differential diagnosis also. That was very nice, doctor. As you mentioned, diagnosis is also important. Knowledge of disease is also important. Our master has mentioned that. So now it's time for an interactive session. It's time to clear the doubts.
I'm sorry for interrupting. Actually, some other person has commented that it is pityriasis versicolor something. Actually, in case of pityriasis versicolor, there will be a hypopigmentation, but spots will be usually large while comparing with vitiligo or while comparing with connective tissue disorder. And also there will be a mild fine scales will be there in case of pityriasis, that will not be there in case of vitiligo and connective tissue disorder. Fine. Thank you.
Okay, thank you, doctor. So now it's time for the discussion session. You can clear your doubts with the doctor, and you can also share the similar experiences, different medicines. So now it's time to discuss. As you hand raise, we can unmute and you can clear your doubts. Doctor, in such cases, like in leukoderma, such cases, you will always use this potency selection. How you are selecting the potency, doctor? Now you explain.
I used to prescribe medicinal potencies for chronic diseases, usually just to avoid an aggravation, as our master had explained. So I used to give medicinal potencies only.
Okay, usually you use 50 millismol potencies only, doctor.
Yes, yes.
So close the screen sharing.
Sorry?
You can close the screen sharing, doctor.
Stop. Okay, sure. Thank you.
Host, now you can make Dr. Dharshana Balamurugan as the co-host.
Any doubts? No? Any other queries which is related to hypopigmentation are related to this disease diagnosis are related to this case or connective tissue disorder? If I
Dr. Ahmad Hassan has raised his hands.
Yeah.
Doctor, now
Yeah,
you can
please, doctor.
unmute.
Thank you, madam. Very nice presentation. Especially you interlinked with the clinical laboratory investigation, U1,
Yes, sir.
RNP, ANA, anti-cardiolipin. So
Yes,
it
sir.
was very useful. Kindly explain again about this test so that our all viewer will be well known to this.
Okay.
Thank you very
Okay,
much.
sir. Sure. Actually, if we are thinking about any connective tissue disorder, we have to do first ANA, which is anti-nuclear antibody, which is very much sensitive in case of any connective tissue disorder. But to uh, to know the type of connective tissue disorder, we have to do ANA profile. In ANA profile, they used to do 10 to 12 types of antibodies. So with the presence of antibody, we can come to know about the exact diagnosis. For in our case, this is mixed connective tissue disorder. In case of mixed connective tissue disorder, especially ribonucleoprotein antibodies will be present. But in case of systemic sclerosis, there will be anti-topoisomerase antibody will be present. Anti-topoisomerase antibody. In case of SLE, there will be anti-dsDNA antibody as well as presence of anti-Smith antibody. So with this, we can able to differentiate the diagnosis. Also, Jo1 antibody, Ro1 antibodies are there. SSA and SSB antibodies are present in Sjogren syndrome, but Jo1 antibodies are present in inflammatory myopathies. So by seeing those antibodies itself, we can able to differentiate the diagnosis.
Thank you very much, madam. But you have
Thank
to show us on the chart so it is easy for us. Thank you very much. Thank you very much. Thank you.
Shall I
Next
say-
time.
1 minute,
Next
sir.
time. Yeah.
1 minute. I'm just sharing. I thought to share that also. I forgot. Can you able to see?
Yeah,
Ah,
yeah,
yes,
yeah.
yes, ma'am.
Yes, yes,
I
yes.
thought to share, but as you asked, I remembering now. So anti-nuclear antibody. These are all the antibodies which can be seen. Anti-centromere in Crest syndrome, Smith SLE and anti-dsDNA in SLE, Rho and Law antigen in Sjogren syndrome, anti-histone antibodies in drug-induced lupus erythematosus. And next slide, and this is the next slide. These are all the antibodies they used to do in case of ANA profile.
Thank you very much, madam. Thank you very much.
Thank you. Thank you.
With
Thank you,
blessings.
doctor. Thank you. Thank you, Dr. Ahmad Hassan. Now all can note down from the slide.
Yes,
Doctor,
yes.
one doubt is there in the chat box.
Yes,
Dr. M. Risa Bagyani has asked about the is there any protocol for vitiligo?
no. Only symptom similarity. There is no protocol actually. I used to give with totality only.
Okay, thank
Actually,
you, Doctor. Thank you.
I have not used any protocols. There may be some protocols, but I never
Used it. Okay, thank you, Doctor. Thank you. Is now others can also interact. You can share your experience also in such cases.
I guess no.
Interactions
always takes time, madam. That's
Yes,
why.
yes, yeah.
Yes,
I can share one patient. I was working in hospital. Then one of our staff, she suffered from SLE. Really,
Okay.
it was very. But in Saudi Arabia there was no homeopathy treatment, so she was on our allopathic treatment. But it is very, you can say, painful, and really it is a very pity condition of the patient. May Almighty bless and grant everybody good health. This is the most thing in the world. Thank you very much, madam.
That is
And
what
I have,
actually I intend to share. There is prognosis varies with vitiligo and connective tissue disorder. Even in our case, actually hypopigmentation got recovered, but we cannot claim that this case has been cured because this is a connective tissue disorder. There may be a remission or recurrences in hypopigmentation. Still, that disease is there. There may some flares will come in future days. That is why.
and the second thing, in leprosy patient also we will get hypopigmented
Yes,
patches.
sir.
Yes. In leprosy, because I was in Indian Council of Medical Research, so
Yes,
I have done this leprosy project, and
yes,
our
sir.
doctor was Dr. K.V. Desikan, Dr. G. Ramu from Chingalpet.
Yes, sir. They actually, I saw a few patients. They used to present with single solitary hypopigmented lesion. That is hyposthetic, yes, sir.
Yeah.
Any other
Madam,
queries or
madam,
discussion?
madam,
Yes,
can you share your number so we can discuss about some patients about the skin diseases?
sir, here in this platform. Okay.
No, yeah, I think no. Your, if it is possible, then please share your WhatsApp number so we can send some.
Yes, sir. Sure,
Yes,
sir. Sure,
thank you.
sir. You can get from that host itself also, sir.
Okay, sir.
Yes, sir.
Okay,
Thank you so much.
thank you, doctor. Now Dr. Ganesh has raised his hands. Doctor, you can ask. You can talk now.
Good evening, all, and good evening, Dr. Dharshana. It's really a very good presentation from you. I think you are a first timer in this platform. Anyway, you have chosen the remedy in a different way, even though you price the remedy and find out that the first remedy is not the one and not the second one, but you go over to Kalita. That is something different. What kind of importance you given to the temperament in choosing the right remedy, or what kind of importance you given to the miasms in this case? Is there anything to add on this?
Sir, actually, we can add the temperament here, but while taking that case, I was not able to talk fluently in Bengali. That was a Bengali patient, so I was not able to get the exact essence what the patient is going to explain. So in that case, I had not used that type of prescription here.
Yes. Then how you foresee the scope of homeopathy in the future?
Yes, sir. If we do anything, but without compromising our principles, it will be good.
What is your success rate in these cases while doing this repertory and all those things?
Sir, actually, there is a success, but especially in case of vitiligo, actually, I was working in dermatology department, so I used to treat vitiligo, psoriasis, and such type of dermatological disorders. Especially in dermatological disorders and even in vitiligo, usually patient responds with medicine, still remissions and recurrences used to come. But in case of acral type of vitiligo, which means patient used to present with the hypopigmentations in hands and legs and mouth. That is acral type of vitiligo. That type of vitiligo is very much resistant to treatment. Otherwise, other types of vitiligo patients used to respond well with this type of prescription itself.
Yes, thank you, Dr. Dharshana. If you go like this, you may become a legend in the field of homeopathy, because that kind of knowledge you are having, and we are really happy to have such a wonderful person here. And
Thank you
I
so
would
much
like
for your
I would like to add some more point here, that some of the important decisions took place in our steering committee. As you all know, that the 1,000-day celebrations are just 39 days away from now, and 38 days away from now. And we have planned a 30-day celebration from April 27th onwards, so that every day a country brings their dignitaries to the stage, and they will present some presentations, just like There will be inauguration, everything, inauguration, slide present, then case presentation, and then even a music like that. The first day will be, we will have a session from our neighbor, Sri Lanka. We will begin the session with the Sri Lanka, and it may go up to May 27th, so that we will have a 1 month program of celebration in this international forum at from 8 p.m. to 9 p.m. And already we have sent the communication to almost all people who are always there. Already doctors from 67 countries participated in the Zoom sessions. And so it will become a big hit as far as homeopathy is concerned. And as you know that the homeopathy, the purpose of our forum is to promote homeopathy, and definitely it will be a big booster. We are trying to bring our president in this forum to inaugurate on May 28th at Trivandrum. That is the physical meeting. There will be a physical meeting where a lot of things are about to be done. And the first thing that will be the actual celebration, inauguration by President, our honorable President. We are trying for that. Then there will be another inauguration for planting nearly 1 lakh plants, homeopathic herbs like that. And there will be 1,000 videos of 2 minutes presentation from different doctors and different dignitaries from different part of the world, as well as those from the film field, political field, and like that, religious field, all that. We are trying for that also, so that all these things will reach the peoples, and people will realize what is happening with the homeopathy nowadays. And so what we are trying to bring homeopathy as a number one. Already all of you know that we are the second largest system practicing all over the world. And this kind of things are going on, that there is hectic activities are going, steering committee meetings every day. Doctors are sitting day and night to work out how to become a wonderful session, and hope that already we have done a lot of things. Even a Zoom marathon was done, the Zoomathon, I must say, the Zoomathon of 48 hours continuously uninterrupted during our 100-day celebration, like that. So Dr. Dharshana, try to join all our presentations on these coming days. Please try to bring your friends as well as your students to this forum. And thank you. Thank you, Dr. Dharshana, once again.
Thank you so much, sir. Thank you so much. There are some doubts in chat box, I guess.
Yeah, okay.
Ma'am, 1 minute, ma'am. Dr. Hariharan has raised his hands from back. So, doctor, you can unmute now. Dr. Hariharan, can you hear?
Okay.
Yes.
Dr. Dharshana,
Yes, sir.
your class is very intelligent. Very intelligent class you have done. And
Thank
your
you.
diagnosis regarding the skin disease is unimaginable. See, I am also treating the vitiligo cases and hypodermal pigmentation cases, but really, in my opinion, it is very difficult to give a prognosis to them, and very much. I am getting the result, but the patient have to wait. See, sometimes it may take 3 years. It will take 3 years for a vitiligo cases to cure.
Yes, sir. Even sometimes it recurs even after 3 to 4 years also.
So that is the difficulty.
Now I thank each and everyone who are presented for today's class. Thank you, everyone. And an important announcement is that For tomorrow's meeting, Dr. Kathy May Lemon from USA will take a session on understanding things in homeopathy through history. And also, as Dr. Danish has already mentioned, we expect all your sincere cooperation for all the success of 1000 Days celebration. Thank you each and everyone who all are presented here. Now I hand over to Dr. Ashok Kumar for Malayalam session.